welcome to the Deep Dive. Today we're diving into a recent research article from the Australian Veterinary Journal all about eastern brown snake envenomation in our canine and feline friends.
Yeah, this study is really cool because it uses a really large data set of cases
Oh, wow.
from a single veterinary hospital in Queensland.
Okay, so it's very focused.
Exactly. Gives us a really good look at what's happening in one specific area.
So a good sample size to draw some conclusions from.
For sure. And what really jumped out at me was just the sheer volume of cases.
Really?
They saw a whopping 338 animals envenomed by eastern brown snakes over just a 6-year period.
Gosh, and that's just from one hospital.
Exactly. That was 240 dogs and 98 cats. Really paints a picture of how common these envenomations are.
Yeah, you don't often think about snake bites being so prevalent. It makes you realize that this is not a freak occurrence. This is something that is probably happening all the time.
Absolutely. Underscores the importance of awareness, especially for pet owners, being prepared, especially during those warmer months.
Yeah, because that's when the snakes are out.
Exactly.
Now, the study also looked at the clinical signs of envenomation. Did it find any particular patterns? Like, did dogs and cats present differently?
It's interesting. While both species frequently showed lower motor neuropathy,
LMN?
yeah, LMN, there's some pretty distinct differences.
Like what?
So for dogs, they were much more prone to preparalytic collapse.
Which is okay.
It's basically the sudden loss of muscle control. They just collapse.
Oh, wow.
Whereas cats, they tended to have more respiratory distress.
Breathing problems.
Yeah, and hypothermia.
Interesting. So very different presentations.
It really shows how the venom affects different species in unique ways.
It makes you think about the different physiologies and how they respond to those different toxins.
For sure, yeah.
The study also mentioned something called venom-induced consumptive coagulopathy, or VICC.
VICC.
Can you break that down for us? What is that?
Yeah, so VICC is basically a really serious complication. It's where the venom messes with the blood's ability to clot.
Oh, so they bleed more easily.
Exactly.
Okay.
And it was diagnosed in a surprising 92% of both dogs and cats.
Wow, that's really high.
But the silver lining is that it usually resolved within 24 hours.
Oh, okay. So very common, but thankfully usually short-lived.
Yeah, generally.
The study also highlighted another concern, and that was hemorrhage, bleeding.
Great.
And over a third of the dogs experience bleeding, sometimes even in vital organs like the lungs.
Yeah, that can be really dangerous if not caught in time.
Absolutely. Now, was that the same for the cats?
Surprisingly, no. Cats were much less likely to have bleeding issues, only 8% compared to the 38% in dogs.
Wow. So a big difference.
Yeah, definitely an area for further research, trying to figure out why that is.
So it seems like we still have a lot to learn about how this venom interacts with different animals. The study also looked at the impact of LMN on survival rates.
Right.
What did they find there?
So, unfortunately, LMN was a strong predictor of lower survival rates. Both dogs and cats presenting with LMN had lower survival rates and longer hospital stays.
So if your animal is presenting with LMN, that's a sign that this could be a more serious envenomation.
Exactly. It's definitely a red flag.
Now, I've always wondered this. Why is it that humans don't really seem to show those neurotoxic signs from eastern brown snakes, but our pets do?
Yeah, that's what's called the brown snake paradox. It's fascinating. Some theories suggest that we humans might just have different receptors for the neurotoxins than dogs and cats do.
So it might not even be binding in the same way in our bodies.
Right. And that could explain why we experience different clinical signs.
Okay, so different species, different responses. Let's talk about treatment now. What role does antivenom play in managing these cases?
Antivenom is definitely the cornerstone of treatment for eastern brown snake envenomation.
Okay, and the study?
The study found that giving antivenom did significantly improve survival rates in both dogs and cats.
That's good news. But how much antivenom is considered enough? Did they say anything about dosage?
Well, that's where it gets interesting. The study found that giving more than the standard dose didn't actually seem to offer any additional benefit.
So more is not better in this case?
It doesn't seem like it, and that kind of raises a really important question. Are our current antivenom protocols actually optimized?
That's the burning question.
Yeah, and it makes you think, is there a risk of overtreatment?
That's a good point.
Definitely something we need more research on, figuring out the most effective dosing strategies.
Striking that balance between giving enough to neutralize the venom, but not causing harm with too much.
Exactly.
Now, the study also mentioned the use of fresh frozen plasma, or FFP.
Right.
What's its role in treating envenomation?
So FFP is often given to animals to replenish those clotting factors that have been messed up by the venom.
Okay, so it's like a clotting factor booster.
Kind of, yeah. But the study found that its effectiveness isn't actually clear and needs more investigation.
So some debate surrounding the use of FFP.
Right.
It seems like this research has opened up a whole new set of questions about the best way to treat eastern brown snake envenomation. What other treatment strategies did the study look at?
Well, they also investigated the use of things like oxygen therapy and mechanical ventilation,
Okay.
which are super important when the venom has really messed up the animal's breathing.
So it's kind of like providing life support while the body recovers.
Exactly. Supportive care is absolutely vital for stabilizing the patient, managing any complications, and ultimately giving them the best chance of pulling through.
And I imagine that also ties back to the importance of early intervention that we talked about earlier.
Absolutely. The sooner you can get that anti-venom in, the better the outcome is likely to be.
So for pet owners, if you think your pet has been bitten,
Yeah.
don't wait. Get to a vet ASAP.
Exactly. Time is really of the essence.
This has been a really fascinating first look at eastern brown snake envenomation. Before we wrap up part 1 of this deep dive, are there any key takeaways you think our listeners should really keep in mind?
I think the biggest thing is just awareness. Knowing the signs of envenomation, getting your pet to the vet quickly, and understanding the potential treatments, these things can truly be life-saving.
I couldn't agree more. Early intervention is everything. We'll delve deeper into the study's findings in part 2 and talk more about what this all means for pet owners. So stay tuned.
Sounds good. You know, one of the things that really stood out in this study was just how differently envenomation can present. Even within the same species, the way it shows up can vary so much.
Yeah, I bet that makes it really tough for vets to kind of predict how each case is going to go.
It does, definitely. It really highlights how important it is to do a really thorough assessment of each patient. Ongoing monitoring and making sure the treatment plan is individualized.
Okay.
Because there's really no one-size-fits-all approach.
Gotcha. So the study also looked at how the venom affects blood clotting. Can you walk us through that a bit?
Sure. So basically, the venom targets specific clotting factors, leading to their depletion.
Oh.
And that disruption in what we call the coagulation cascade, that's what causes VICC.
Right. And did they look at how long it took those clotting factors to kind of get back to normal?
Yeah, they did. They analyzed how long it took for them to return to normal levels, which gives us some really interesting insight into the recovery process.
And anything surprising there? Any differences between dogs and cats?
Actually, yeah, dogs seem to recover a bit quicker than cats.
Huh. Interesting.
It could be because of variations in their baseline clotting factor activity or maybe in their ability to regenerate those factors.
So even at the molecular level, we're seeing these species-specific differences.
Exactly. And figuring out those differences is key to developing more targeted treatments, more effective treatments.
Absolutely. Now let's go back to the fresh frozen plasma, the FFP, for a second. The study talked about how its effectiveness in managing VICC is still kind of up in the air, right?
Right, yeah, it's still unclear.
So even though it's often used to replace those depleted clotting factors, there's not enough solid evidence yet to really support using it routinely.
That's right. We really need more research to figure out if it truly makes a difference for these animals.
Okay, now what about the anti-venom they used in the study? Did they notice any variations in how well it worked?
So all the animals in the study got the same anti-venom, which is produced by Summerlin serums.
Okay.
And what the researchers wanted to know was, does giving higher doses lead to better outcomes? Well, what they found is that giving more than the standard dose didn't necessarily improve those survival rates.
Huh. So more isn't always better, huh?
It seems that way, yeah. And, that brings up an important question. Are we getting the dosing right currently? Could we be over-treating some animals?
That's a good point. It's a fine line, right?
Yeah.
You want to give enough to neutralize the venom, but not too much to cause other problems.
Exactly. So finding that sweet spot, that optimal dose, is really important.
Okay. And it sounds like more research is needed there, too.
Absolutely.
All right. So we've talked about antivenom, FFP. What about the supportive care aspect? The study mentioned oxygen therapy and mechanical ventilation. Can you tell us more about those?
Yeah, so these interventions can be real lifesavers, especially when that venom has really hit the animal's respiratory system hard.
Okay.
Oxygen therapy helps maintain adequate oxygen levels, obviously,
Right.
while mechanical ventilation basically breathes for the animal when they can't do it effectively on their own.
So it's all about keeping them stable, giving their body a chance to recover.
Exactly. Supportive care plays a huge role in stabilizing the patient, managing complications, and ultimately increasing their chances of survival.
And it goes back to that early intervention thing, right?
Yeah.
The sooner you can start supportive care, the better.
Absolutely. Early intervention is key.
And the study also highlighted how important the timing of that antivenom is,
Yeah.
right? Like the sooner the better.
Exactly, yeah. Antivenom works by neutralizing the venom that's circulating in the bloodstream. It can't actually undo any damage that's already happened, so that early intervention is absolutely crucial.
So, bottom line for pet owners,
Mhm.
if you think your pet's been bitten, every minute counts.
Absolutely. Don't wait. Get them to the vet as quickly as you can.
Okay, good advice. This deep dive into eastern brown snake envenomation has been really eye-opening. Before we wrap up part 2, any final thoughts for our listeners out there?
I think it's important to remember that while eastern brown snake envenomation is serious, it's not always a death sentence.
Okay.
With the right care, a lot of pets can and do recover fully.
That's good to hear.
Early recognition, getting them to the vet right away, and that teamwork between the vet and the owner, those are all crucial for getting the best possible outcome.
That makes sense. It's a partnership. And this study gives us some really valuable data to help guide those treatment decisions and inform future research. We'll continue this conversation in part 3 and explore some of the broader implications of this research and where we go from here. So stick with us. So we've really gotten into the nitty-gritty of eastern brown snake envenomation from a scientific perspective.
We have.
But let's talk about what this means for pet owners.
Great.
What can they take away from this study? What are the actionable steps to help protect their furry friends?
I think the biggest takeaway is just awareness.
Yeah.
Knowing that eastern browns are out there, especially in those warmer months, that's key.
Yeah.
And, keeping pets leashed when you're in areas where snakes might be.
So being extra cautious in those environments.
Exactly. Prevention is always the best medicine.
Absolutely. But let's say a pet does get bitten. What should an owner do right away?
The most important thing is to seek veterinary attention immediately. Don't wait for symptoms to show up, because sometimes they can be delayed or really subtle.
So if you even suspect a bite, get to the vet.
ASAP.
Okay, good advice. And what about while they're on their way to the vet, anything an owner can do?
Yeah. Keeping the pet calm and still as possible can really help.
Okay.
It can slow down the spread of the venom, and if you can carry them to the vet so they don't have to exert themselves, that's ideal.
Minimize that movement.
Yeah.
Got it. Now, the study's findings about the antivenom dosing were really interesting.
Yeah.
Could this change how vets approach treatment in the future?
I think it definitely should. The fact that higher doses didn't necessarily lead to better outcomes,
Right.
that's something vets will definitely have to weigh carefully.
So it's not just about giving more, it's about giving the right amount.
Exactly. And at the right time, and future research might focus on refining those dosing guidelines even further.
Right.
Maybe tailoring them to things like how severe the envenomation is or how long it's been since the bite.
That makes sense. So kind of a more personalized approach.
Exactly.
And then there's the whole FFP question. That's another area where more research is needed, right?
Yeah, for sure. There's still so much we don't know about how to best manage these cases.
Now, what about long-term monitoring after a pet's been treated? Are there any lingering effects owners should look out for?
Well, most pets do bounce back completely,
That's good.
but some might have some ongoing neurological issues or muscle weakness.
Okay.
So regular checkups with the vet are really important just to make sure they're recovering as expected.
So even after that initial crisis is over, staying on top of their health is key.
Absolutely.
Well, this deep dive has really shown how important it is for pet owners to be informed
It is.
and to have a good relationship with their vet.
For sure, it's a team effort.
It is both owners and vets play such a vital role in protecting pets from eastern brown snake envenomation.
Couldn't agree more.
This has been an incredibly informative deep dive. Thank you so much for sharing your expertise with us.
Happy to be here.
And for our listeners, remember, vigilance, prompt action, and a strong partnership with your veterinarian. Those are your best defenses against eastern brown snake envenomation from Vet Neurojar. Keep those minds-inspired hearts light and tails wagging.